All right. Good evening, everyone, and welcome to Atp Live Monday. I'm just going to try and share the videos so everybody can see and hear. And after that, we'll start. But if you can hear me and you can see me, just reach out in the comment section of wherever you're watching from, and then I will know that we're live. Okay, but I just want to quickly share the videos and the links to all our various platforms. Okay. So welcome. You can also join me to share. Good evening, everyone. Welcome to Atp Live Monday. Just trying to share the video. Now we're good to go. And Instagram people, I hope you can hear me and can see me as well. So welcome. Just sharing and making sure everybody can see. So all right. Okay. Welcome, Instagram people. Yes, show me for King. Thank you for letting me know you can see me and you can hear me. All right. Welcome, everybody. So if you have any questions, feel free to start dropping your questions. I'm also just making sure the Facebook people are able to see and hear me, and then we're good to go. So, but if you have any questions, you can start dropping your questions now, and then I will answer them as soon as I can. So start to drop your questions. So ATP Live Monday is a program where we have 60 minutes for you to ask any questions you have about the health of your children, and then we can I can answer them as soon as I can. So welcome everyone. I think I'm just trying to check that I actually share the video and not the okay, I think all right, let me just share again. Okay. I can see you all watching. So just give me a couple of minutes to share. I think I was sharing the link instead of the video, but I'm just sharing the video now. But if you have any questions for those of you on Facebook, start to drop your questions now. This internet is slow. Okay. Welcome. I hope you had a good day. I'm also trying to just trying to make sure I put everything where it should be. All right, I can see a couple of questions on Instagram already. Just a couple of more minutes. Let me just share the video and then we're good to start. Um, all right. One more minute. The sharing is plenty because you have to share to everybody. There's some people will come for me later on that they didn't say it to. Okay, good. I guess we're good. All right, so welcome ATP Live. Quickly have to answer Instagram question because your question going to disappear. Chami for King, my baby is 10 months old. You notice a lump behind your baby's ear. You don't know what it means. So we need to see a lump before we can say what it means. So you can post a picture of it on our Facebook group. If you post a picture on our Facebook group, we can have a look and then look whether it's a lymph node or something, or better still, you can just go to the hospital and let a doctor have a look for you. Every lump has to be examined. We need to know what it is, and it is after we know what it is that we can now tell you what to do. I don't want to make assumptions because assumptions can be very, very dangerous. So Charming, that is what you need to do. You really need to go to the hospital, see any of our colleagues, let them examine your child, and then they can tell you what the lump is, and then they will tell you what to do about it. All right, I hope that's helpful. I quickly have to answer Instagram question because the questions tend to disappear because it's not going to be showing live. So, but Facebook, I can see you. Your questions will be there. All right. So let me now properly welcome everybody. I've done all my sharing now. Okay, so welcome to ATP Live Monday. ATP Live Monday is a program where you get to interact with a pediatrician, ask any questions that you have about your children's health, and you get an answer live. So it's a live session. But if you have any questions after the live session, you can always go to Ask the Pediatrician Facebook group and you can post your questions there. And from Mondays to Saturdays, and our professionals, our moderators will be there to answer your questions. And if you are watching this as a repeat or a recording, so you cannot post your question if you are not watching it at 6 p.m. West African time on the Monday. That means you're watching a recording. And if you're watching a recording, please just go straight to Ask the Pediatrician Facebook group. And that is where you post your own questions and we will answer. Because some of you, I see you coming after the live session is over and still dropping questions. We won't be able to see it after the live session is over. And so we won't be able to answer you. So make sure if you are not watching the live session, it's not Monday, it's not 6 p.m. West African time, please go and post your questions on our Facebook group and we will be able to answer your questions there. Thank you so much for joining me. So I have 60 minutes. Okay, more like 51 minutes left now to answer all the questions that you may have about the health of your children. But like I said, after the live session, feel free to head over and ask on our Facebook group. So Rayo Hajai, thank you for joining us from Instagram. He said, "Good evening, ma'am. My little 3-month-old had a hair piercing 2 weeks ago. It is slightly swollen. What can I apply or do?" Okay, who did the hair piercing? What did they put in the hair? So I've written an article on hair piercing because a lot of us just take our babies to random people and they just put in the earrings in their hairs. The procedure has to be done in a hygienic way, in what we call aesthetic way, in a way that germs should not be introduced into the child's hair. Okay. Secondly, the method that you are going to use has to be something the child is not allergic to. So some of our children, some of the kind of metals or hearing that we use, children are allergic to them. So if you really go to people who are trained professionals, hair perforators who are supposed to do it, who do hair piercing, they will use what we call hypoallergenic earrings, and you can buy it yourself. Something hypoallergenic, something the child is unlikely going to react to. And then when they are going to do the perforation, they have to use sterile material so that there will not be infection. So if the child already has hair swelling following ear perforation, it is most likely that either the child is having an infection because the procedure was not done in a sterile way, or the child is reacting to whatever product method that you are using the material of the hearing. So what you need to do really is to have to go to the hospital because they need to they may have to take out that hearing. And the reason why I'm saying this is that some of you will eventually come to us later and your baby's hair the baby has lost a lot of the tissue. You now see this very big hole, or the hair will even cut straight through. And then people now like, doctor, what can I do about it? And that is going to be plastic surgery, because that's the only way they can fix it back. So the time to fix it now before it causes further damage is to go to the hospital, let them take off those earrings, let them clean off any infection. If it's releasing pus, they have to remove the pus. They may need to give your child antibiotics treatment and let the hair heal. And I always tell parents, strictly speaking, hair piercing is not an emergency. There's really no need to rush to pierce your baby's hairs. All right. So if you're not sure you're going to do it in a proper way, in a sterile way, using the right product that your child is not going to be allergic to, just leave the children's hair alone. It's not compulsory and it is absolutely not necessary. Children can always pierce their hairs when they are ready, they can, whether they want to do 3 or 4 hair piercing, they can always do it. So it's not like something we must do. So, but I think for us, it's more of a fashion thing. And people think, oh, that's how you know a girl from a boy. I really don't think so. But if you have to do it, just make sure you do it the right way. And otherwise, there's really nothing emergency about doing hair piercing. You can do it properly. I think some hospital will do it for you, or some fashion shops and all that, they do it properly. They have the proper instrument, they know how to sterilize, and they have the hypoallergenic kind of earrings to use. Otherwise, you may end up having all these issues where the children now develop hair infection. They will lose substantial parts of their hair, and then you are going to end up spending a lot of thousands on plastic surgery just to fix the hairs. If you go to ATP Facebook group and just type hair piercing, you will see all sorts of pictures that we see, and it's very, very, very sad and very painful for the children, for the mother, for everybody, from something that is absolutely really not necessary to do, like an emergency, something you can always do when you have the time to do it. So that's just my recommendation, Rayo. I hope you get that sorted as soon as possible. All right. Shilozi, I'm still on Instagram, Facebook. I'm coming, don't run away. My baby is reacting to a particular malaria drug. She's having rashes that itch all over her body. What can she take to stop it, man? So the first thing is that if a child is reacting to a drug, then you stop the drugs. That's the most important thing to do. The most important thing is to stop whatever the child is reacting to. And I hope you were prescribed that medication. And I sincerely hope it is not self-medication. That is number one. So, but if you think the child is reacting to a drug, just stop the drug and then go back to your doctors, and your doctors will be the ones to tell you what to do. So, there are anti-allergy medications that doctors can give. So, but I really, really worry what kind of medication your child is taking as anti-malaria, because if your child is taking ACT, very, very rare for us to see those kind of allergic reactions, but there's no never. So what you need to do is stop the medication, go to your doctors and let them. But I just want to be sure that what your child is having is actually a reaction, which is why it's so important to go to your doctor, because your child may have fever and rashes, which is a completely different diagnosis. But in Nigeria, we always assume everything is malaria. So every fever is malaria. And now that the child is having rashes, you think it's a reaction to the malaria drug. It may actually be a child who is having what we call a viral exanthem, like any of those fever and rashes condition. There are a lot of them: measles, chickenpox, all sorts of German measles and all that. There are a lot of conditions where children will have fever first, then they will have rashes later. So it may even have absolutely nothing to do with malaria, absolutely nothing to do with medication. So it's very important that we're sure which one it is. So I would rather recommend you go to your doctor. But if your doctor is sure that it's a drug that they recommend that your child is reacting to, what I know is that once you stop the medication, the rashes should start to clear, and the doctor will give me something that looks like an antihistamine, which is okay, but always very careful with Finnegan kind of medication. Some children can also react to it and can be a very bad reaction. So it's not something I personally tend to recommend as well. So, but that's what you really need to do. But let's be sure first that we're treating malaria. Was this child tested for malaria? Was it confirmed malaria? What anti-malaria were you giving? And all that. What other medication are you giving apart from the anti-malaria? So we really need to make sure we have all the details and make sure the right thing is being done. So that is what I will recommend for a child. Let's see. All right, I think we should not start on Facebook. Today everybody is rushing to super special. Last week I was practically begging for questions. All right, Bukola Faniwa. I hope I got that correctly. Good evening. When the appropriate time for a 3-month-old? When is the appropriate time for a child of 3 months start sitting with support? Number one, a 3-month-old child is not sitting with any support, so don't force the children to sit. Okay, what I want from a 3-month-old is neck control. Can the baby carry their neck first? That is it. So you don't need to force. I know it's something we do a lot in Nigeria, especially once the child is 3 months, we start putting them in cattle, we start trying to force them to sit. And I always like to tell parents, you don't need to teach children to sit. You don't need to force them to do things when they are not ready for it. They will do it on their own when they are ready for it. So averagely, most children will sit with support from 5 to 6 months. So it's a 5 to 6 month old scale. Neck control is what we normally get at 3 months old. So there is no rush. We're not rushing anywhere. There's no price for a baby who starts to sit at 3 months or who work at 7 months. No, there's no price. So there's no reason to be putting babies under a lot of pressure. And I see a lot of mothers asking these questions and getting anxious and getting worried. So what I normally recommend first is for you to know what is normal. And we have a beautiful website article on is your child's development on course. So you tend to know when is the appropriate age for each of those milestones. So neck control is 3 to 4 months, sitting with support is 5 to 6 months, sitting without support 7 to 8 months, crawling 9 to 10 months, standing 11 to 12 months, walking 12 months. And even all those time me have given you now, it is the average. So some children will do it earlier and some children will do it a little bit later and it's still normal. For example, so we have what we call the range for which your child will achieve the milestones. Then we have what we call the cut-off age, and it is that cut-off age that is important. That is the age when a pediatrician will start to worry about your child. So I'm not going to worry about a child who is not walking until the child is 18 months. So even though most children walk at 12 months, but I will only start to worry about walking at 18 months. So I will always give that extra time for children who are still normal, but they just be a little bit later than the other, with still within normal limits anyway. So no forcing any 3-month-old baby to sit. Can this child keep the head straight? That's what we mean by neck control. That is all. If the child is able to do that, the child is able to smile and recognize you, follow you with their eyes. That is all we want at this age, nothing else. So Bukola, don't force this baby to sit, all right? Amanda Hongwe, good evening. My husband had chicken pox 2 weeks ago, and I have a small baby of 9 months. Yeah, sorry. Please, I noticed small rash on my baby's chest. The rashes are not much. I'm worried. I hope it's not chicken pox. Wait, Amanda, until I see your baby, I won't be able to hope or not hope with you. So, but the truth is, if your husband has chicken pox, 2 weeks ago, your baby was already exposed to chicken pox, and your baby can have chicken pox. I mean, your baby has been exposed already. And if your child has not yet taken chicken pox vaccine, then your child can have chicken pox. So there's nothing to worry. There's nothing you can do about it anymore. All you can do now is that if your baby has chicken pox, we deal with it. There's nothing we can do. So if your baby is having rashes, if you're worried it's chicken pox, It's the same fruit. There's no specific treatment for chickenpox anyway. Just make sure the child is eating well, drinking a lot of water. If the child is itching, apply calamine lotion. If the child has fever, give paracetamol. After 1 week, it will clear away. So I know you are really worried and anxious and you are hoping your baby does not have chickenpox. But the truth is, I think it's better you just make up your mind that your baby can have chickenpox. And if your baby has chickenpox, it is not the end of the world. We deal with it and we move on and your baby will be fine. So that's all. The only way to avoid it is for your baby to have had what we call a chickenpox vaccine. But once the baby has been exposed, the child is exposed. Sorry, there's nothing you can do about it. But I hope your baby is okay. Your baby will be fine. Don't worry about it. All right. Adeju Mobiola Midiola Sumba. Good evening, Doc. My baby of 7 months refused to take homemade food. So what food is your baby eating? What is your child eating now? Adeju Mobi, because your child current weight is unknown. Anyway, what I recommend is that you can go to our Facebook group, go to the guide section. Maybe I need to use my phone to show people. People don't always know where the guide section is. Let me see whether I'll be able to show it. I'm not sure whether it's be able to show on my phone. But if you go to our Facebook group and look at the menu part, you will see the guide section. If you click on that guide section, we have all sorts of guides. We have the guide on breastfeeding. The second one is on complementary feeding, and we have loads of posts under that guide section. So we have videos that you can watch. We have articles you can read. We have posts on tips for complementary feeding and all that. So I want you to go through that. You really need to understand complementary feeding, and you'll be just 7 months old, so you've only been doing complementary feeding for 1 month. So give it time and put into practice some of those principles you're going to come across in that in that guide section, and you'll be able to do it. So it's not something my baby does not do it and that's the end of the world. You keep practice, you keep trying. So I always tell parents, for example, you have to offer one food for 13 times, so 1, 2, 3, 4, 5. You keep doing it every day, at least for 1 week, before you say that, okay, the child is not taking this one food. Then you go for another one. You try variety, the presentation, the color, everything matters. So there are lots of tips. Even if you go through on our Instagram or even our Facebook page, we have all these like flyers or graphic designs on all those tips as well on complementary feeding. So most parents, we just need that patience and that persistence. Sometimes we're always just in a hurry. We just want them to give them the food and let them just eat it. Of course, there are children like that who will try anything. You put anything in their mouth, they will swallow it. But there are also fussy eaters who you need a lots more patience with. So it's just a matter of just being patient and we will get there and you don't give up. So the child still need to eat food, and there's no other food than food that the child has to eat. And it's not a drug thing, because I know that's what most of you are waiting for. Whether there's a drug I can recommend for you as a pediatrician that will make your child to start eating all the food, there is none. Even the so-called what people sell to parents and tell you this is an appetite booster, is super appetite, is all sorts of names. I've forgotten the names now. All those drugs are dangerous. You should not be giving them to your children. Okay, they are not actually meant to be appetite booster drug. It's just that they have side effects of appetite boosting and people start using it. But what people don't know is that apart from what you are getting, there are several other things and other effects of that medication that you don't want that you are going to get as well, especially in a child. So please don't give your children so-called drugs, and also the so-called multivitamins and all that. They are not appetite boosters or anything. Your children need vitamins, but they don't need to take it to eat food. So I hope we get that as well. So go through our guide session on complementary feeding, or watch past videos of, I think I talk about complementary feeding all the time. Go through that and then keep practicing with loads of patience and you will get there. All right, Instagram people, feel free to ask your question. I'm always checking so that I will quickly answer you before your question disappears. All right, the next question, Eunice Apology. What can be the cause of a 7 weeks to always vomit after eating? Okay, let me first stop there and say there's a difference between vomiting and reflux. And I really, really want to know which one your baby has. Okay. So vomiting is an active process. So when you want to vomit, you retch, you see, is as if something, as if the child is forcing themselves. So they will rage and it is very projectile. So it will travel far. So what is coming out from the child, it will travel far and it will be a lot. Uh-huh. And then it will, when you immediately the child feels vomiting, you see as if the tummy is empty. So vomiting is, and usually the child is not well. The child is sick. A child who is really vomiting is not well. The child is sick. The vomiting comes with so much force. It's forceful. That's what I was looking for. Because projectile sounds to medical jargon. It's forceful and it goes far away. It travels far from you, and it is quite a lot. That is what we mean by vomiting. Okay. Now, newborn babies sometimes after the feeding, they bring back part of the milk. It comes out from their mouth, sometimes a little bit from their nose, but it just come out. It's not much. It's a little. It is not forceful. The baby is otherwise still happy, doing whatever they're doing, and it's something you can just clean up with a babe. We call that reflux. This is so important for you to understand the difference between reflux and vomiting, because reflux is nothing we worry about. I've explained why baby have reflux. So babies tend to have reflux because, number one, the stomach is small. The distance between the stomach and the mouth is very short, and the food itself is liquid, is watery, so it can easily flow back and forth. And of course, what's supposed to be like what we call the sphincter, or the gates that's supposed to close the food way, the esophagus from the stomach, it's not yet fully functional. It's not yet closing properly in babies, so it is easy for food to flow past the esophagus. That's why you as an adult, you can eat with your head upside down and it will not come down, because there are sphincters that will block the food once it enters into your tummy from coming back the other way around. But in babies, it is not fully formed. So it is easy for babies for the food to flow back. So when we tell you to keep your baby upright for 15 to 30 minutes, we are using gravity to keep the food down, allow a little bit of digestion to happen so that it will move along before maybe lie down. Then the chances of it returning is a little bit reduced. It's not completely removed, but it's a little bit reduced. So that is what happened in reflux. So reflux is something babies have, and as they get older, it will resolve. It's not something to worry about. And by the time babies start eating solid food and they are bigger, the distance is small now, it will resolve on its own. Some babies have bad reflux. Like sometimes we have to make the milk thicker. We use what we call breast milk thickener. Sometimes we give them what we call anti-reflux medication, something to kind of keep down the food from flowing. But that's for children who have bad reflux and they are losing weight and all that. But most children, they don't need all that. They'll be fine. They are not losing weight. They're happy, so we don't worry so much. But if your child is actively vomiting, that child is sick. We need to know why the child is vomiting. Does the child has what we call pyloric stenosis, or the child has other medical conditions that can cause severe vomiting that age? So those ones need to go to the hospital. So if your child is always vomiting, and I've described vomiting to you, because parents use the word vomiting, but they meant reflux. So we always have to be sure which one you're talking about. So I've told you, reflux is not forceful. It's a little. The quantity is not usually much. It's not the whole thing the baby just ate. Whereas in vomiting, it's forceful. The child is not well. It is almost everything the baby ate. And it will go far away from you. Is vomiting, that child needs to see a pediatrician, know why the child is vomiting. This is reflux, just watch. But if the reflux is also bad, see the pediatrician, and then they will tell you what to do. I hope that's helpful. Yeah, thank you for letting us know the child is on exclusive breastfeeding. The next question, Doreen Chinaye, when did babies start seeing and recognize faces? Baby can see from birth. They can see right from the day from the time they come out from the mother's womb, but they are very short-sighted. So, but usually by age of 6 weeks, we expect them to start recognizing faces, and we expect them to fix and follow. So when we say fix and follow, so if you get something bright colored, I don't have anything bright colored, but this I have my hair piece here, just assuming it's red. So if you put something bright like red color, baby will look at it. That is what we call fixing. And then when you move it, the child will follow you with their eyes. That is following. So we expect them to start doing that by 6 weeks. And you can use the mother's face as well. So if the mother look at the baby at 6 weeks, they will smile at you. They are what we call social smile. They recognize their mother's face, they will smile. And if the mother move her face away, to the side, baby will track the mother with their eyes. That is what we call following. So we expect them to start doing that by 6 weeks. But baby can see right from the time they are born, all right? But they can only see up to the breast milk, up to the breast, not too far away. So when she won't put baby in sitting position, so you don't need to put baby in sitting position. Baby themselves will start going into the sitting position when they are ready. And usually that's around 5 to 6 months. And that is when you can now support them, So usually when baby have neck control, you start seeing that they carry their head. When you carry them in your hand, they don't lie flat. They want the head up. So that's how you know that. Then when they want to start assuming sitting position, as well, you start seeing them turning or trying to go into that sitting position, so that around that age too, they start to roll. So they can roll from the back to the front and vice versa. And then they start to want to assume sitting position. And that is when you can put them. And even at that point, you are not supposed to make them sit forever. Usually it should not be more than 5 minutes. So, and then you support their back. Once you start seeing it, because the way you know a baby is ready, if you put them in a sitting position, if they are almost completely flat with their bending over, that means they're not ready. But if they're sitting and with some support, they can keep straight a little bit, then that means they are ready for that. So it's not something you need to force a child to do. It's something you see, and then it's a little bit tricky to explain that to parents, but that is just how to say it's something you see, but it's not something you try to force babies to do. Because some of us, the way we force our baby to sit when they're not ready, you're putting too much unnecessary pressure on the bones of their back, and you start seeing the back coughing and all that. It's punishment for the baby. So don't, and there's no hurry, there's nowhere we're rushing to. So I hope that's helpful. All right, let me quickly take a question from Instagram before I disappear. Unique Cake, good evening. You need to give us cake without this your advertisement program. Anyway, I'm just joking. My baby is 2 months and 2 weeks. Is about 7 kilos. Wow, what is the best weight? You notice the soft spots in the head is there to seal off. The soft spots in babies, what we call the anterior fontanelle, closes at 2 years. So there's no rush for that. It closes between 18 to 24 months. Just leave it alone. I don't know why we have so much obsession with this anterior fontanelle. Is it there? Is it breathing? Is it there? It's always there. You don't need to worry about it. Just ignore it completely. Whether you see it, whether you feel it, whether it's persisting, whether it's not persisting, just leave it. Just ignore. There's nothing wrong with it. And it closes by 24 months maximum. Between 18 to 24 months, that is when it closes. And there's no need, while I'm on it, let me quickly add that there's no need to start applying oil, and it doesn't need anything. Just leave it alone. The anterior fontanelle is one part of the body that you just leave it alone. It doesn't harm you, it doesn't disturb you. You don't need to do anything to it. Just let it be. All right. So that's that. And there's some children also we call the posterior fontanelle. The posterior fontanelle closes earlier. It can close from birth, but it closes between 0 to 6 months as well. Again, there's no need to worry about it. Okay, Bashira Eleshinde, good evening, Deb. What are the signs of teething? Okay, so teething means a baby is bringing out teeth. That is just a simple definition. I think that makes sense. It is not something that needs to come with any sign. You just wake up, you see the teeth, end of story. Doesn't need to give any sign whatsoever. Okay, but sometimes some babies can give you some signs. So you can see some babies tend to, rub the gum a little bit more when they're about to start bringing out their teeth, or they want to bite on something. You start seeing them either biting on your nipple, or when they're sucking, or they, even their hand or something like that, or they can bring out a little bit more saliva. So those are the common symptoms that you can see in a child who is bringing out teeth. Otherwise, since most of them don't have any symptoms, whatever, you just wake up and you see the teeth in their mouth. Okay. And so please, all those things that people have told you about teething, okay, just throw them away. So teething does not cause fever, it does not cause rashes, it does not cause diarrhea, it does not cause vomiting, it does not cause any illness. Teething does not make a child sick. Okay. Teething is not an illness. Teething is a normal developmental milestone. It's just like a child sitting, walking, running. It's part of normal development. It doesn't cause any illness to children. Okay, so don't assume a child who is having fever, diarrhea, vomiting, cough, rashes, mention anything, it is not teaching. Just take teaching out of the picture. That is the first thing I would like to say. The second thing I would like to say is that please, your child does not need any drugs or any products or anything at all because they are teaching, because that's the next follow-up question. So I can always give you the answer before you ask. So don't go and start giving your children what are the things people give? Baby Rex, I forgot their names, just escaped my brain. But you know what I mean. The so-called teaching mixture, don't give. Bomoro, what's the other one? I've forgotten their names. So, Bonner Babe, all those stuff. Please do not give your child any so-called drugs because your child is teething, or teething powder, or teething mixture. I'm begging you, in the name of God, don't give it. Okay. So if you want to know why you should not go and Google and read about my Pekin. My Pekin is a teething mixture. We lost a lot of our children from renal failure due to that my Pekin saga. Children do not need any drug for teething. If your child is sick, your child has fever, your child has cough, your child has diarrhea, your child is vomiting, please don't say it is teething. Take that child to the hospital. Let the doctor examine the child and tell you what is wrong, and let them treat that child. It is not teething. Don't go and stay at home and say, it is just teething. It will go, or I will give teething powder. Don't. That's dangerous. So I hope everybody is listening now, and they are able to um follow that instruction. So don't give any so-called teaching mixture. All right. Now, Instagram people, okay, unique cake. You say your baby is 4.1 at birth. Okay. Your baby was quite big. I'd like to know if too much crying has any effect on babies. No, it doesn't have any effect. And if your baby is crying too much, and you don't know what is making the child to cry, then you have to see a pediatrician to know why. It is more of what is making the child to cry rather than the crying itself. The crying itself is not causing any harm to the baby. All right, so like more Miriam Heniola, maybe your 5 months is having recurring catarrh for 2 months. You've been to the hospital, they've given you medication, it's not going, so you have to go back. And why are you having catarrh for 2 months? There's something is causing it. So the first question I always want to ask you: are you breastfeeding your baby exclusively? Is your baby going to a crash? So you have to know what are the risk factors that is making your baby to be having these recurrent respiratory infections. So that is the first thing. So it's not just enough for you to go to the hospital and for your doctors to give your child medication. We need to know why. So what is it that this child is being, because catarrh or whatever is an infection, the child is being exposed to it, and why. So first, your 5 months old should be on breast milk only. That's why I want you to exclusive breastfeed your babies, because exclusive breastfeeding protects your baby against all these viral infections and all those ones that are causing catarrh. Number two, I hope you're not taking your baby to a crash, because if your baby is going to crash or daycare, they keep getting exposed to other children who is also having cough and catarrh, and they just keep infecting themselves. Or your other children, the older ones, they go to school, they come back, they bring the cough and catarrh home for the baby at home. Also, are you taking the baby to the kitchen, frying oil, smoke, somebody smoking in the house, using firewood, or using generator, the fumes, those are the things that irritate the children that cause this catarrh and all that. Okay, so you need to go there. Then you also the doctors need to examine your child, make sure there's also no other things like adenoids or other things your child is allergic to that may be causing recurrent, because 2 months is a long time to be having cough and catarrh, or catarrh is too much for 2 months. So we need to know what the trigger is, what is happening, and we need to address it. What we can address, at least we need to address it. So if you have not seen a pediatrician, you may rather want to go see a pediatrician rather than just going to doctors who are just going to give you ampiclox and pyridine and tell you to go. So it is not enough most times for us to just doctors to just give you drugs, and you need to ask those kind of questions. Why is this thing not going? Why? And do I need to come back again and again? So that, and then for me, it's more important to focus on the why rather than just something to give a relief and then go away. So the why is the more important part of it. Yeah, I know you're talking about pyridine. I got it. So you're still asking. Okay, it's the same question. Yeah. Okay, yeah, it's the same question. I've answered that. Sami Obimba. Good evening. My baby of 3 months had fever of 38. Okay, that was high. And gave paracetamol. Good. It went down. It didn't rise again. What could have prompted it? Anything. It could just be that you have given the child too much clothes covering, or it could be the beginning of another illness, could be a viral infection. Anything can cause fever, even dehydration, the fact that the child does not have enough of fluids in their body, anything. So just watch for now. If the fever is not coming up again, no problem. If it comes up again, then that's when you go to the hospital. So that's what I would say. Wait, Sarah Hetim, I'm not sure what you said earlier, Sarah. So your question is incomplete, so I can't make sense of it. But if you are trying to ask a question, please ask it again, because we didn't get the first part. Amadi, let me just check Instagram people. Okay, Kafila, I'll come back. Amadi say my 4-month-old is passing greenish stool. She's sitting well and drinking water. Number one, your 4-month-old should not be drinking water. Your 4-month-old should be on breast milk only. Okay, so what food is your child eating? So your child should be on breast milk only. No food, no water, just breast milk only. Okay, and if you're giving your baby water and all that, so greenish stools in babies could be, number one, that the baby is not getting enough food. We call it starvation stool. All right. But if you are giving formula, some formula contain iron and they can make your baby stool also to be greenish as well. So you really need to know, or it could be something you are eating and that has a color green that is passed to the baby through breast milk as well. So we need to know which one your baby is on. Okay, so you're on formula feeding, so you're not doing breastfeeding. So you need to check whether the formula you're giving is a type that will make the child to pass greenish stool. So you need to check that. And she can't pass through without warm water. That is not appropriate. So again, formula feeding predisposes your baby to constipation, especially if you are also making the formula. If you are not following the strict direction of what scoop of milk to what volume of water, okay? Those are the things that will predispose your child to constipation. Because some of us, we just mix the milk as the spirit directs you. You just put the milk and then put the water and just shake. There's an amount of milk that must go into an amount of powder that must go into an amount of water. It's not just that the Holy Spirit directs you or your spirit directs you. You have to do it properly. And then when you're giving formula, you also have to give your child plain water according to the manufacturers. So, but the best thing to avoid all this is for you to give your baby breast milk only, which is what we recommend. So make sure you are doing the right thing, and then all will be well, hopefully. So Kafila is asking from Instagram, my 8-month-old likes lying on her chest to sleep. No, your 8-month-old should not be lying on their chest to sleep. Your 8-month-old should lie on their back to sleep. And it is not the baby that tells you what to do. You teach the baby the right thing to do. And the right thing to do is for all baby to sleep on their back. Okay. there's what we call SIDS. SIDS means sudden infant death syndrome. Sudden infant death syndrome has been associated with the baby sleeping on the front rather than on the back. So it is one of the risk factors for SIDS. So please, I know you mothers like that sleeping on the tummy because you think, oh, it makes them calm and other. No, it is wrong. Okay, this is research. I don't have. I can't be going to talking jargons with mothers. All I can tell you is that this is a recommendation. This is evidence-based information. This is research. This is not just what we think or what is good. The recommendation is that all babies should sleep on their back always. Always. As long as they are sleeping, put them on their back. It is a dangerous thing for you to put your baby on their face or on their tummy to sleep. You are putting them at risk of sudden infant death syndrome. Sudden infant death syndrome is when you wake up and the baby is dead for absolutely no reason. And one of the things that has been found as a risk factor from all the researches done on such babies is the fact that they're sleeping on the tummy or the face rather than sleeping on the back. So please, your baby should sleep on the back. I hope you've heard me. Everything, it should be on the back. That is number one. Then you say, can your baby eat anything you eat? Yes. Your baby can eat anything you eat, but you have to be conscious of the texture. So your baby can eat anything you eat does not mean you're going to give your baby pounded yam certain 8-month-old. So at that age, they should be taking soft food. It doesn't mean they can't eat the pounded yam, but it's not going to be like rock solid like the one you are going to eat. It has to be something softer. It has to be in a smaller quantity, and of course you have to understand all the things that should come along with it, including the protein and all the other classes of food. So it's not just one food only. Okay, so for more information on complementary feeding, just go to our groups, go to the guide section, do guide 2 on complementary feeding. All right, so many questions today, so I need to be fast. Okay, we've answered the question on 4-month-old. Okay, direction. Is it normal for 8-week-old baby to pull watery pool? Okay, so for babies at this age, 2-month-old, your definition of watery pool is what matters. Okay, so because they don't pass hard stool like you and I would do, what they pass is a mixture of solid and liquid. I always, for Nigerian audience, I always like to use the egusi soup as a good example. So egusi soup, you have some part of it that is like solid clumps, and then you have the watery part of it. That is a kind of stool that we see in babies who are on exclusive breastfeeding, and that is normal. We don't classify that as watery. Okay, that is normal stool. Okay, so for you to know what is watery stool for this age group, it has to be something like completely like water that sink completely into the diaper, or the nappy, so you wouldn't even see anything on top. Everything is sinking like urine into the diaper. That is what we define as watery stool in that age group. But their usual stool is just soft, like solid with some little bit of water. That is normal for them. That is not watery stool. That is not diarrhea. That is normal, and they can pass that stool 8 to 12 times a day. 8 to 12 times a day is not diarrhea in that age group. Is also normal. Okay, so it's always important that we know what is normal and what is abnormal, so that we don't start to look for what is not lost. Okay, and what we recommend, the color can be yellow, it can be brown, it can be anything. The color actually depends on what you're feeding your baby with. Okay, so but what we recommend for your 2-month-old is breast milk only. Don't give water, don't give ribena, don't give agbo, don't give formula. Just give breast milk only, and then they should have soft, semi-formed yellowish stools that look like melon soup or egusi soup, and that's what we will say. All right, Juliet Sunday want me to tell you the symptoms of measles. So measles is a viral infection. So it's one of those viral exatems. So viral exatem are you have fever and you have rashes. So before you, well, maybe you have measles, the fever is very high. They have very high fever. They will have red eyes, they have cough, and then they have running nose. So we have what we call the three C's of measles: the conjunctivitis, the catarrh, and the cough with eye fever. So you have that for a few days, and then the next thing the child starts having rashes. And these rashes in measles start from what we call the hairline, something like we call it it's as if you can see, you can also feel it a bit maculopapular rash, but it starts from the headline and then it will spread down to the rest of the body. And that, so those are the signs and symptoms of measles. So having said that, don't always assume every rash is measles. Don't always make assumptions. So there are rashes that look like measles and they are not measles. So the first thing you must see in measles, there must be the fever, there must be the cough, there must be the catarrh, there must be the red eyes. So those are the signs that will come first before the rash. The rash alone does not mean your baby has measles. And a lot of mothers, we always like to, a lot of what I call experienced mothers, your neighbors, everyone they say, it is measles, it is chickenpox. It can't be more than those two. It is not true. Even if the rash look like measles, it can be something else, because drug reaction can give the same rash. Other things can give the same rash. So don't make assumptions about measles. If you are not sure, the best thing is to go to the hospital and let the doctors be the one to make I always don't want mothers making diagnosis of measles because they always get it wrong. So let the doctors be the one to tell you your child has measles. Don't take it from your neighbor or from your friend, because they are not doctors and they may be wrong, even though they think they know it, but they may be wrong, because everything that look like something, it is not always the something. So that is different between the doctor and the mothers. Okay. All right. Now, Joyce, Frank, good evening. What level of neck control should I expect from your 7 weeks? So 7 weeks don't have neck control. Neck control is a 3 months to a 4 month old scale. So stones disturb the 7 weeks old baby with neck control. Neck control is from 3 months. Of course, maybe it's a little bit earlier and they can start showing signs even as early as 2 months. But I don't want you to start saying, what level should I expect? You don't need to expect anything from a 7 weeks old, okay? By 3 months old, that's when we should now expect something. And that is when we want to, don't start giving yourself unnecessary headaches or anxiety about neck control, about this, about that. At a 7 weeks old, no. And if your baby's neck is sitting to one side, that even has nothing to do with neck control. You have to see a pediatrician, because there are conditions that can cause what we call torticollis, where the neck of the baby is bending to one side, either to the left or to the right. There are many reasons. There could be what we call shortening of the muscles of the neck and all that, injuries during delivery and all that. But please see a pediatrician if your baby's neck is tilted. Otherwise, baby's neck should not be tilted. It should always be midline, and it should be soft, not like it's completely on one side. That's what I meant. So, but don't worry about neck control. Your baby is 3 months old. That's what I would say. All right, lots of questions on development today. Another person is asking, my 9-month-old is not yet crawling? There's no need to worry. Some babies don't crawl. Some babies never crawl. So crawling is not really a deal breaker for us, because some babies never crawl. Some babies move with a bum, and it runs in some family. They don't crawl, they just bum shuffle, that what we call, they just move with their bum, you see them moving. That's how they're going to crawl. That's their own crawling. So they don't crawl on their, hands and feet. So it's nothing to worry about. Just let the baby be, and maybe just keep the crawling and go straight to the standing and walking. So it's fine. It's normal. It's a normal variation. It is nothing to worry about. All right, I have a question on Instagram. Let me quickly take it before it disappear. Okay, unique cake again. There's something we call unright. It causes hair loss, whitish patches on the body. So if your child has any rash on their body, you have to take them to the hospital. You have to see a doctor. I don't take native diagnosis of skin rashes, because many things people call, like for example, let me give you Yoruba, which is I'm more familiar with that. Everything is ela, 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 ela. Every rash is almost ela. So, but we know that even all those things they call ela, they are different in from the doctor's perspective. There are different kind of rashes, but to the people, they'll just call you the same name. It's a such like you are calling same rash. It may be a different kind of a rash. It may be different cause. And rashes have different causes, different types and different causes. And the treatment of rashes, which is the most important thing, is we don't just, because a lot of people will tell us, oh, what should I use? What should I rub? What should I apply? No, that's not the right question to ask when you see rashes. The most important thing to ask about rashes is, why is this child having these rashes? The rash could be as simple as the fact that the child is reacting to the soap or the sponge or the cream that you are using. And the simple solution is not any rubbing anything. The simple solution is stop. Stop the powder, stop the soap, stop the cream, stop whatever it is you're applying on the baby's body that the child is reacting to. That's all. So it's not everything that you have to apply something. Okay. Some rashes could be due to infection, maybe it could be bacteria, it could be fungal. It may just be simple thing, paying more attention to hygiene, hand washing. That was everybody should not carry baby. Wash your hands before you touch a baby and all that. And if there's a bacterial infection, we're going to give antibiotics. If it's a fungal, it's going to be antifungal. It's not the same thing. But most people, when you show them rashes, most mothers, they just say, go and buy that cream because that's what worked for me. It may not necessarily be the same kind of rash that your baby has, that this baby has, even though they appear to look the same. So don't make assumptions or diagnosis of rashes. Don't call it any native name, because from our experience, the same name is used for maybe 5-10 different kind of rashes that are of different cause, of different treatment modalities entirely. And some of the treatment you give even make things worse. At least some of us are honest enough to tell us that when you ask your questions. Because when you use the wrong treatment, it's going to give the wrong outcome, and it can even make things worse. For example, if your child has a bacterial infection and you go and apply a cream that has steroids, it's going to get worse, because steroid will make things worse for the child. So that's why you don't do self-medication. In fact, you will never see us make diagnosis of rashes based on what you tell us. We have to see it. I always say, you need to send me a picture. I need to see it. There's no way I will know, no matter how good your description is. One picture is worth more than 1,000 words. And even sometimes with the picture, we're still not sure. We need to ask you hundreds of questions before we know, okay, yes, this is it. And sometimes we even need to get the specialist opinion. So for rashes, don't make assumptions. Go to the hospital, let the doctor have a look for you, and then they will tell you what they think is happening, and then that's how we know the right intervention. All right, I've answered that question. Mayoko Halaita, good evening. My time with took immunization, it has been cranky. That is expected, and not sleeping well since Saturday. Okay, can I give Piriton? Why Piriton? Piriton, please avoid using some drugs. There are some drugs you should not use without a doctor asking you to. I think the only thing I think I'm comfortable with mother using is paracetamol. Every other thing, or the warming drugs, every other thing else, please don't use it unless the doctor asks you to. Some drugs are dangerous, you don't know. So if your child is cranky, why is the child cranky? Is the child in pain? Is the child having fever? That is what, so for immunization, the child may have fever. Give paracetamol. The child may be so you just need to be gentle with the way you handle the legs. So when they give injection on both legs, the child is a little bit sore. So I always tell mothers, the gentle, the way you carry the baby, don't just be carrying them. The legs are sore, just be mindful of that. If there's any swelling, you can apply ice packs on that. Usually 2 to 3 days, most of them will be fine. Today is already 2 days. Okay, it was Saturday, Sunday, Monday. Yeah, so just 2 to 3 days, the children will be fine. Don't give Piriton. I don't know why you want to give Piriton. For Piriton is for if a child is having allergic reaction or something. There's no basis for that. Ibuprofen, I'm not always comfortable with ibuprofen because some children can have bleeding and all that with ibuprofen. It's something you have to give after food. You can't just give ibuprofen without food. So, and some others don't always be mindful of that. Paracetamol is okay. Be gentle with the legs. If there's any swelling, redness, apply ice packs and all that. If you do all that and your child is still cranky, then you have to go to the hospital, because we need to be sure the child is also not having the serious kind of unusual reaction to the vaccine, which can happen in some instances, but they are not very common, very, 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 very rare, but it can also happen. But basic things, paracetamol, gentle handling, ice packs, most babies will be fine after 2 to 3 days. There should be no problem. But don't give any of those drugs you mentioned. All right. Baby not crawling. I think we've answered that already. Elizabeth, good evening to you. Please, I just want to see my 2-year-old urine stains are pants like dark brown. That's unusual. I put the pants in water and the color was scary, dark brown color. She's not sick, and what could be the cause? Well, number one, change the pants and watch whether the brown color comes back again or not. And no, the first thing you need to be sure is your 2-year-old who wipes the baby. Are you the one cleaning the baby after the poo? Because I guess your 2-year-old is still either in nappies or just being potty trained and all that. So we need to know that. So if the color is coming back, then you have to take the child to the hospital, because they need to examine the child. They need to check whether there's any bleeding or anything coming from anywhere. It's very unusual color anyway for that age, because the only thing I can think of is stool. If a stool come out from the wrong place, which is possible, or it's moved from the front to back to the front because they are close by. For a 2-year-old, that can happen. So but you for take off the old pants, clean your babies properly, then put on a fresh one and watch whether it happens again. If it happens again, then that's when you now need to go to the hospital. We need to take the urine. We need to examine the child. We need to examine, do urinalysis as well, and then we can tell you what to do depending on what we think. It could even be as simple as something else, like the baby play with something and put it in the nappy. Sometimes parents worry about things and it's just something not even medically related at all. So we have to be sure first. But if it's something, it will persist. So that's how we know it is something else, and then we can investigate it. All right, Joy Mwaguma, my 4-year-old has been given hepatitis B vaccine. Okay, in December last year, his schoolmate died of hepatitis B. Is there any risk for my son? No, I don't think so. Should he go for hepatitis blood test? No. Why do you need to worry about your son because somebody else died? You don't know the story of the other child. You don't know whether that child was immunized and all that. So your child has been immunized. End of story. You don't need to start worrying about your baby, and just let the child be. And hepatitis B is a blood or sexually transmitted. You don't get it by sitting next to somebody who has it. You don't get it by using the spoon or all those. You only get it if there's a mix of blood. So, and I'm wondering what will cause your child's blood and another child's blood to mix, or mix of blood or sexual. It's very unlikely for that to happen. And I'm actually curious as how you get to know the information that this child died for hepatitis B. I mean, normally people's medical information should be confidential. So I don't know whether it's the school that gives out that information. But if your child has been immunized, that is all that is important, and you don't need to worry about it. Okay, 4-year-old Sammy, my 4-year-old keeps having high white blood cells. We have done the throat surgery, but it still comes not as often as before. So your child has adenoids. Is that what you meant? Your child has already had adenoid enlargements, and you have already had adenotonsillectomy, I think. So how often is your child not having so the initial white blood cells, so high white blood cells just mean your child has infection. Most of the time, there are other reasons why your child could have high white blood cells apart from infection anyway. So it is not directly related to the adenoids. Okay, the adenoids, if they get infected, your baby's white blood cells can go up, but your baby's white blood cells can go up for other reasons, other infection that has nothing to do with the throat. So I want you to first separate the two, because you just make an assumption because you assume that all the time your baby's white blood cells are high. It's because your child has a adenoids and you've done the surgery, so you should come. No, white blood cells has absolutely nothing to do with adenoids. It has to do with infection. So whether it's infection in the adenoids, infection in the hairs, infection in the urine, infection anywhere, anything causing infection, your baby's white blood cell will go up. So it is not only to do with the throat or the adenoids at all. So that is the first thing I want you to understand. That is number one. So don't focus more on the adenoids part of it. The second thing is that there are other reasons that your baby could be having elevated white blood cells. And then what is even this level that is elevated? Because the level in children that may look elevated, if the people who are doing your blood tests are using the adult values, may actually be correct. So children's values tend to be higher than that of adults. So that is another thing we need to be sure of. Then we also need to make sure your child doesn't have other conditions that can cause the white blood cells to be high. For example, children who have sickle cell anemia tend to have high white blood cells, even when they are well, when they are not sick. It has nothing to do with. So I would just recommend see a pediatrician in a teaching hospital level. There are hematologists. Those are the specialists in anything that has to do with blood, white blood cells and stuff, so that they can do other things. And if they tell you there's nothing wrong, relax, then you can just relax. But make sure you go see the specialist if you're worried about it. But it has absolutely nothing to do with your adenoids at all. All right. All right. Oh, time has gone. All right. We have to round up now. We'll just answer the remaining questions and then we can stop. Okay, Instagram, no more question. What's of sleeping on the side? Baby less than 1 year, sleep on the back. It's as clear, it can't be clearer than that. Not on the side, not on the front, on the back. Back. End of discussion. Don't, but it's the back. So don't worry, okay? Can breastfeeding mother take garlic, ginger? You can take whatever you like as long as it doesn't hurt your baby. And some babies are sensitive to some of these things. So if you notice your baby is reacting to it or is becoming sensitive to it, just stop. But for yourself, you can take whatever you like. If your baby has watery stool, give ORS, give oral zinc, pay attention to hygiene, wash your hands, and that's what you need to do. For Shakura Sarah, 15 months old, take preparing food, but she sucked way too much breast. There's nothing like sucking way too much breast. Let the baby be sucking. We expect to breastfeed up to 2 years, so let baby be. Don't harass the baby. Sami, he said across the question. I hope I've answered it now. I don't know who is on where. All this one I don't understand. The school authority get the information. Yeah. Okay. All right. The school authority. I hope they don't get sued. That is wrong. They should not have given you all that information about a child. It is wrong. I mean, you just think about it. Anyway, if one should take I don't know. Please, I don't know what is that June by say whatever. But what I know is that if you are breastfeeding and you are pregnant, please avoid herbal concoction because I don't know what is inside and I don't know whether it's going to go to your breast milk and whether it's going to affect your baby. So before you start taking, I'm not a doctor for adults, so I'm not going to tell you what to take or what not to take. You know, I'm a pediatrician, so I stick with my children. So, but please, anything that you will take that will affect my children, please don't take. So if you are still breastfeeding, I beg, don't take all those things. Okay, just leave. Let's finish breastfeeding, and then you can do whatever you want to do. Can hepatitis B mother breastfeed her baby after giving baby HPV vaccine? So if you are hepatitis B positive as a mother, we have to give your baby hepatitis B vaccine at birth. We also have to give hepatitis B immunoglobulin. We need to give those two immediately the baby is born. So your doctors would have told you, so most of hepatitis B vaccine is always available, but immunoglobulin is not readily available and it's a little bit expensive, but it has to be given. So that is the only way your baby will be protected against hepatitis B virus. So you have to make sure your baby was given. If not, you can't breastfeed your baby because the baby can have hepatitis B. So it is not only enough to give the vaccine, we have to give the immunoglobulin, because when we give the vaccine does not start to work immediately. It will take 1 month for the vaccine to generate a reaction. So what will protect your baby before that 1 month of the vaccine kicking in is the immunoglobulin, because the immunoglobulin goes into action immediately. So all mothers who are hepatitis B positive, your babies have to be given hepatitis B immunoglobulin and hepatitis B vaccine together at birth. And that's the only way you can breastfeed. Otherwise, if you breastfeed, you're going to make the baby to have hepatitis B infection. Uh, Amadi Ngosishuku, does it have any effect if I skip breastfeeding a day and skip breastfeeding the next day? I'm not sure which one is your first question. Amadi, I can't remember your first question though, because I'm looking for it now. I have lost it. Were you the one that asked about using the ABA drugs? Uh, I can't remember. Okay, yeah. Okay, your baby is passing greenish too. Okay, yeah. Okay, I see your question now. So if I skip breastfeeding and skip breastfeeding next, I don't understand. Why do you want to skip breastfeeding? You should breastfeed your baby all the time. Okay, you should breastfeed your baby all the time. Uh, I'm not sure I get your question though. Anyway, so my time is up. I'm sorry, it's already 10 minutes past time. But if you still have any question, feel free to post your questions on our Facebook group, and I will try and answer them. Our time is up now. We've got to close now. But if you still have any question, feel free to post your question on our Facebook group. Thank you so much, so much. Today's been so busy. I have only 1 minute to catch my breath, but thank you so much. It's lovely to have you here, and I love the fact that many of us are here. But like I told you, obviously this is just an hour event for the live session. If you still have any question, and I'm sure you see some of you still have your questions, please go to ATP Facebook group. Let me just show you, and you can post your questions on our Facebook groups. So you can always post your questions there Mondays to Saturdays, and I will try and answer your questions. So I'll see you same time next week, Monday. But remember, on Thursday, there's ATP Hour where you can watch a teaching on one of the topics that you've asked questions about. Last week we talked about urinary tract infections, and I think a lot of people really learned a lot from that. So just watch out for what I'm going to be teaching out on this Thursday. Till then, have a wonderful, wonderful evening. And it is bye from me. Bye bye.